Alright, today we're going to go over Pharm Exam 4 study guide. We're going to go over the ones that we're having trouble with, so let's jump right into it. What do you think the signs and symptoms of abstinence syndrome would be? Violent sneezing, weakness, nausea, vomiting, diarrhea, abdominal cramps, bone pain, muscle spasms, and kicking movements. Alright, what are the side and adverse effects of acetaminophen? So it's like very toxic to the liver, so you have like the hepatic necrosis. So, the antidote for acetaminophen is acetylcysteine. What allergy do you have to watch for when taking that? Sulfa allergies. Alright, so, would you get Addison's disease or Cushing's disease if you stop taking the glucocorticoids abruptly? Addison's, and Cushing's like a long term. Alright, so methotrexate, you're going to also be taking this with a certain type of drug. What would you take it with? Folic acid, and you'll take it 24 hours apart. Alright, what are the signs and symptoms of allopurinol? Hypersensitivity syndrome, rash, fever, eosinophilia, liver dysfunction, kidney dysfunction, GI upset, and then if you use it for more than 3 years, microcataracts. What's a COX-1 enzyme? Enzyme responsible for inflammation, prostaglandins that promote PEG aggregation and protect the stomach and intestinal lining. Alright, what are some examples of narrow spectrum antibiotics? Penicillin and erythromycin. What are some examples of broad spectrum antibiotics? Tetracycline, cephalosporin, and vancomycin. Alright, what are some examples of cephalosporins? Ceftriaxone and cephalexin. What are some examples of fluoroquinolones? Levofloxacin and ciprofloxacin. What are the drug interactions of fluoroquinolones? Increased effects of oral diabetes medications. Take 2 hours apart from antacids, iron, and dairy. Alright, what are the side effects of tetracyclines? Hepatotoxicity, renal toxicity, and phototoxicity. What are the drug interactions with tetracyclines? Increased effects of digoxin and warfarin, and then no dairy, iron, antacids, because tetracyclines like to bind to iron and calcium so it won't get absorbed. What are the contraindications of tetracyclines? Don't give to pregnant women and don't give to children under 8 because you could get discolored teeth. What are some examples of macrolides? Erythromycin, clindamycin, and azithromycin. What are macrolides used for? Can get into bones to treat infections. What are the side effects of macrolides? Hepatotoxic, nausea, vomiting, and diarrhea. And you might get C. diff. What are the drug interactions of macrolides? Increased effects of digoxin and warfarin and avoid antacids. What are the side effects of aminoglycosides? Ototoxicity and nephrotoxicity. What are the side effects of sulfonamides? Bone marrow depression, seizures, Stevens-Johnson syndrome, nephrotoxicity, and phototoxicity. What are sulfonamides contraindicated in? The last 3 months of pregnancy. Alright, what drugs with taken with insulin may cause hypoglycemia? Aspirin, oral anticoagulants, alcohol, oral hypoglycemics, beta blockers, and tetracyclines. What drugs with taken with insulin may cause hyperglycemia or lower blood sugar control? Thiazides, glucocorticoids, oral contraceptives, thyroid drugs, and smoking. What are the signs and symptoms of hypoglycemia? Headache, dizziness, confusion, slurred speech, hunger, nervousness, anxiety, agitation, tremors, lack of coordination, sweating, tachycardia, and seizures. What are the signs and symptoms of hyperglycemia? extreme thirst, dry mucous membranes, poor skin turgor, polyuria, fruity breath, fatigue, tachycardia, and Kussmaul's respirations. All right, so insulin regular is different than all insulins because you can give it what way? IV. All right, what is the drug class of glimepiride and glipizide? Sulfonylurease. What are the side effects of glimepiride and glipizide? Low blood sugar, sulfa allergy, and risk of developing cardiac arrhythmias. What is the drug class of metformin? Biguanides. What are the side effects of metformin? Very serious reaction with IV contrast dye because the interact can cause renal damage, diarrhea, GI upset, and metallic taste. What is the drug class of glucagon? Glycogenolytic drug. What are the side effects? What is glucagon used for? Diabetes mellitus and hypoglycemia. All right, 50% dextrose is what drug class? Monosaccharides. What is 50% dextrose used for? Diabetes mellitus, unresponsive hypoglycemia, and hypoglycemia when NPO. What is levothyroxine or Synthroid used for? Hypothyroidism. What are the side effects of levothyroxine or Synthroid? Nervousness, insomnia, weight loss, tremors, headache, nausea, vomiting, diarrhea, cramps, tachycardia, palpitations, hypertension, dysrhythmias, angina, and thyroid crisis. What are the what are the interactions with levothyroxine or Synthroid? Increases T3, T4 metabolism, increases warfarin but decreases digoxin. Is levothyroxine or Synthroid contraindicated in? MI patients, renal disease, decrease the dose, and hyperthyroidism patients. When do you want to give levothyroxine or Synthroid? First thing in the morning before food. Hydrocortisone is what drug class? Glucocorticoids. What is hydrocortisone used for? Adrenal insufficiency. What are the side effects of hydrocortisone? Increased appetite, sweating, headache, flushing, mood changes, altered sleep, high heart rate, high blood pressure, hyperglycemia, abnormal fat deposits, wasting, edema, glaucoma, and peptic ulcers. What are the nursing considerations of hydrocortisone? Keep an emergency dose with you and take in a stressful situation. If you're sick, you're going to need to take this for life. Don't skip doses or stop suddenly. Take in the morning with food. Monitor blood sugar and pressure. What do rapid-acting insulins end in? Log. How long does rapid-acting insulin take to kick in? 5 to 15 minutes. How long does rapid-acting insulin take to peak? 30 minutes to hour. How long does rapid-acting insulin last? 2 to 4 hours. All right, what are the drug interactions of hypothyroidism? Increases warfarin, decreases digoxin. What are the drugs of hypothyroidism contraindicated in? MI, severe renal disease, and hyperthyroidism. What is fludrocortisone? Mineralocorticoid replacement and adrenal insufficiency. Hypertension and edema indicate that dose is too high. Monitor vital signs, weight, and F&E. Alright, what is the mechanism of action of estrogen? Stimulates uterus blood flow and growth of uterine muscles. What are patients at risk for when taking estrogen? Blood clots and endometrial cancer. What is the mechanism of action of progesterone? Suppresses contraction of smooth muscle while baby is growing. What are the side effects of progesterone? Constipation, teratogenic effects, and breast cancer. What is progesterone used for? Hormone therapy, dysfunctional urine bleeding, and infertility. How are we going to administer progesterone? Subcutaneous. What vital sign are we watching when taking progesterone? Neither. Alright, sibutylene. What is the drug class? Tocolytic selective beta 2 adrenergic receptor. What is the mechanism of action of sibutylene? Decreases the frequency and intensity of uterine contractions to suppress but not prevent preterm labor. Decreases myosin LC kinase enzymes that stimulate uterine contractions. What are the side effects of sibutylene? Pulmonary edema. How do we administer sibutylene? Sub-Q. What vital sign are we watching when someone takes sibutylene? Mother's heart rate to not exceed 120. Alrighty. Nifedipine is what drug class? Tocolytic calcium channel blocker. What is the action of nifedipine? Safer than tributaline, decreases intensity and frequency of contractions, decreases myosin LC kinase enzymes that stimulate uterine contractions. What are the side effects of nifedipine? Can compromise uterine placenta blood flow, so when baby is born, focus on ventilation to restore circulation. What is the mechanism of action of magnesium sulfate? Inhibits the release of acetylcholine at neuromuscular junction and relaxes smooth muscle. What are the side effects of magnesium sulfate? Muscle weakness, hypotension, headache, dizziness, hypotonia in the baby. Why do we use magnesium sulfate? Stop premature labor. What vital signs do we have to monitor when someone's taking magnesium sulfate? Blood pressure and heart rate. What is the drug class of oxytocin or pitocin? Hormone. What is the mechanism of action of oxytocin? Increases force, frequency, and duration of uterine contractions. What is oxytocin used for? Post-term inductions or labor that isn't progressing. What are the side effects of oxytocin? Water intoxication. What is oxytocin contraindicated in? Uterine rupture, more than 5 births, active genital herpes, fetal distress, fetal cord lapse, any placental abnormalities, water intoxication. What is the drug class of misoprostol? NSAID, prostaglandin analog. How do we administer misoprostol? Rectally. What is the mechanism of action of misoprostol? Promotes cervical ripening. What is misoprostol used for? To induce labor. What are the side effects of misoprostol? Hypovolemia, decreased LOC. Methylergonavine is what drug class? Ergot alkaloid. How to administer methylergonavine? PO, IM, or IV? What are the side effects of methylergonavine? High risk of hypertension, convulsions, and deaths. What is methylergonavine contraindicated in? Babies inside mom. Alright, what meds decrease contraceptives effectiveness? Rifampin, ritonavir, anti-epileptic drugs, grapefruit, St. John's wort. Contraceptives decrease the effectiveness of what meds? Warfarin, insulin, and oral hypoglycemics. Alright, what are some examples of category A pregnancy drugs? Thiamine, levothyroxine, dextromethorphan. Some examples of category B pregnancy drugs. Moxicillin, metformin, hydrochlorothiazide, metronidazole, clindamycin. What are some examples of category C drugs? Tramadol, gabapentin, amlodipine, and trazodone. What are some examples of category D drugs? Lisinopril, alprazolam, losartan, phenytoin, and lithium. What are some examples of category X drugs? Warfarin, methotrexate, and valproate. Alright, what's the route of aqueous humor? Produced by ciliary body, secreted into the posterior chamber, circulates around the iris into the anterior chamber, exits the anterior chamber via trabecular network and the canal Schlemm. What is the main side effect of primary open-angle glaucoma? Can't see peripherally. When do you start seeing the side effects of POAG? Once the octave nerve damage has occurred. What are the risk factors of POAG? Most important symptom is increased ocular pressure, family history of POAG, advancing age, African and South American ancestry. How do we treat POAG? Reduce elevated IOP, it's the only modifiable one, and chronic therapeutic drugs. What are the first-line treatments for glaucoma? Timolol, bromoridine, latanoprast. What is the drug class of timolol? Beta adrenergic blocking agent. What is timolol used for? POAG. What's its mechanism? Oh, and initial therapy and maintenance therapy. What's its mechanism of action? Reduces production of aqueous humor. What are the adverse effects of timolol? Bradycardia, AV heart block, bronchospasms. What we got to monitor when someone's taking timolol? Pulse rate before and after administering. What do we have to be cautious with? What patients have to be cautious with when using timolol? Patients with heart failure. Bromonidine or Alphagen is what drug class? Alpha adrenergic agonist. What is the mechanism of action of bromonidine? Reduces aqueous humor production and possibly increases outflow. It may also delay optic nerve degeneration. What are side effects of bromonidine? Dry mouth, ocular hyperemia, headache, local burning, itching, blurred vision. Potentially drowsiness, fatigue, and hypertension. Alright, latanoprast is what drug class? Prostaglandin analog. What is the mechanism of action of latanoprast? Lowers IOP by facilitating aqueous humor outflow by relaxing ciliary muscles. What are the side effects of latanoprast? Harmless brownish coloration of the iris, increased pigmentation of eyelid and eyelashes, blurred vision, burning, stinging, conjunctival hyperemia. What are the second-line treatment for glaucoma? Cholinergic agonists, carbonic anhydrase inhibitors, timolol, bromidine, and latanoprast. Carbonic anhydrase inhibitors are used for what? Long-term treatment of POAG. What is the mechanism of action of carbonic anhydrase inhibitors? Decreased production of aqueous humor. What are the side effects of carbonic anhydrase inhibitors? Malaise, anorexia, fatigue, paresthesias, may cause acid-base problems, weight loss, and GI upset. What are the contraindications of carbonic anhydrase inhibitors? Teratogenic to animals, contraindicated in pregnancy. What do cycloplegics do? Paralyze ciliary muscles. What do mydriatics do? Dilate the pupil, allow you to see inside the eye better. Alright, phenylphenolphthalein is what drug class? Adrenergic agonist. What are cycloplegics, mydriatic, and what are they used for? Exams and surgery, stuff like that. Alright. What is a narrow angle glaucoma? Sheesh. Displacement of the iris. Alright, what's acute conjunctivitis? Inflammation of the conjunctiva in response to an allergen. What are the side effects of allergic conjunctivitis? Itching, burning, thin water discharge, usually 20 minutes after exposure. How do we treat allergic conjunctivitis? Antihistamines, NSAIDs, and then short-term glucocorticoid use. Alright, drugs for the skin. Alright, what do we use topical glucocorticoids for? Relieves inflammation, itching, and it's a drying agent. What are the adverse effects of topical glucocorticoids? Thin skin, stretch marks, purpura, spider veins, excessive hair growth, and then maybe systemic toxicity. How do we administer topical glucocorticoids? Apply in a thin film and gently rub into the skin. Don't use occlusive bandages. What is the mechanism of action of keratolytic agents? Promote shedding of the horny layer of the skin. What are keratolytic agents used for? Treat conditions where there's a normal or abnormal thickening of the skin. Alright, what does UVA penetrate? Epidermis and deep into the dermis. What does the UVB penetrate? Epidermis. It's like sunburn and tanning. What is SPF an index of? Protection of UVB protection. What is psoriasis? Red patches with silver scars. How do we treat psoriasis? We can do topical drugs like glucocorticoids, vitamin D analogs, vitamin A derivative. You can use methotrexate, glucocorticoids, and cyclosporin. Why would we use methotrexate for psoriasis? Reduces proliferation of epidermal cells, highly toxic, and should only be used in patients with severe psoriasis. Why would we use glucocorticoids for treating psoriasis? Most commonly used for topical drug of psoriasis. Good stuff, cyclosporins, good stuff. Alright. Can read these. Fuck it.